welcome you to introduce yourselves in the chat. Feel free to add your names, pronouns, organization, jurisdiction, and land acknowledgement as we go and get started. With that, my name is Resham Patel. I'm a faculty member here at the University of Washington School of Public Health, and I am delighted to welcome you here to this Lessons Learned since the 2021 Pacific Northwest Heat Dome session. On behalf of the Collaborative on Extreme Heat Events, it is truly a pleasure to welcome you here today. I wanted to start with land acknowledgement. So on our next slide, and welcome you to also add your land acknowledgement in the chat as you introduce yourself. The University of Washington acknowledges the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. I want to humbly take this opportunity to thank the original caretakers of this land, where I'm at here in Washington State, and I encourage and invite everyone to introduce themselves and feel free to include your land acknowledgement in that introduction as well. I want to take a few moments here to introduce the Collaborative on Extreme Heat Events as context for today's webinar. So what is the Collaborative and how did it start? The Pacific Northwest found itself unprepared for the 2021 heat dome, with many people dying or suffering from heat-related illnesses as a result. Following that unfortunate heat dome, regional leaders called on their public health agencies to prevent future heat waves from having such devastating impact on human health. The Collaborative on Extreme Heat Events, established in 2023 with support from the University of Washington Center for Disaster Resilient Communities and the Urban at UW Research to Action Collaboratory, brings together public health and partner agencies representing Seattle, Portland, and Vancouver, BC metro areas to work on identifying extreme heat response innovations and partnership opportunities that advance public health and improve community resilience in the face of climate change. In the next slide, I want to share a planning committee for the Collaborative, who's comprised of practitioners from these three metro areas, along with our University of Washington team, convened in September 2023 to co-design a series of objectives and activities to meet these goals. Many of these planning committee members are on the line today, including three from whom you'll hear from shortly. In the year that followed, we hosted a 4-part webinar series centered on cross-cutting themes related to extreme heat and health, as well as a transdisciplinary workshop to identify and prioritize action and research recommendations for the future. The webinar series, co-designed by the Collaborative, aimed to build a community of practice and foster peer learning through the sharing of the 2021 heat dome experiences and resulting interventions or mandates. Webinars featured 11 speakers and centered around key themes identified by the Collaborative's planning committee. These included early warning systems for extreme heat events in the built environment, extreme heat, and community partnerships. We'll add links in shortly where you can find recordings of these 4 webinars on our website. We then held a half-day virtual participatory workshop in spring of 2024. The Collaborative invited additional transdisciplinary partners from each region, including government, community-based organizations, and researchers from a variety of disciplines. We used dynamic brainstorming throughout facilitated breakout sessions to identify goals and methods and approaches, as well as partnership principles and divergences. The Collaborative on Extreme Heat Events synthesized the robust discussion and range of identified recommendations into a practice and research agenda. This included 44 recommendations across 7 themes, such as built environment, collaboration, communication, and health risks. A summary report of those workshop outcomes was presented at a reconvening of these partners last year, where attendees prioritized action and research agenda items. You can find the report along with a recording of key highlights on our website, which is available by the QR code on the screen and a link that we'll add to the chat here shortly. We know that many of you on the line today participated in these activities, so thank you for being part of our journey. And for those who may be joining us for the first time, welcome. We're excited to have you part of our growing community of practice. With that in mind, I'll turn to today's webinar. The background on how the collaborative originated and some key activities over the last 2 years really set the foundation for today's webinar. The Collaborative's Planning Committee designed today's webinar as an opportunity to reflect on the progress made since the 2021 heat dome, to explore what changes have been initiated or implemented, what new partnerships have been formed, and as we approach the 5-year mark since that incident, how can we be better prepared for the next extreme heat season? What areas remain and what significant gaps require immediate attention? Looking to the themes of the co-developed webinar series and practice research agenda, those themes such as communications, community partnerships, and infrastructure and built environment, today's webinar will feature speakers from all 3 regions to share about progress made and to highlight what is remaining. We know that this will spark questions and great ideas for moving forward. As a reminder, we will be turning off the chat momentarily, so please add your introductions if you haven't had a chance to do so yet. And we will keep the chat disabled through the presentation to minimize disruptions. However, we will highly encourage you to add questions for the speakers using the question and answer feature. Presenters and members of the planning committee will respond to questions in the chat as they're able, and we'll hold time after the presentations for discussions that are based on submitted questions. With that, I'm excited to share with you here our speakers for today, representing all 3 regions. Give you a moment here to take a look at our speakers coming from Multnomah County, Oregon region, as well as Vancouver, British Columbia, and King County, Washington. You'll note that the speakers for today include a planning committee member as well as a partner from their region that they've invited to co-present in this reflective activity of thinking about where we've been and where we're headed from the 2021 heat dome. So with that in mind, I'm delighted to welcome our first set of speakers from Multnomah County, Brendon and Jaimes. Over to you.
Thank you, Resham. Let me get some slides pulled up here. All right, you should be able to see that now.
Yes.
So as Resham mentioned, we had this big convening and we developed a research and action agenda. And so I'm going to touch on a few of the themes from that agenda where I feel like we've demonstrated some progress since the 2021 heat dome in Multnomah County and in Oregon broadly. So the first one that I'm going to mention, well, I guess the themes are workforce policy and infrastructure. And so I'm going to start by talking about workforce just briefly. In Oregon, we have an initiative called Public Health Modernization, and this is our effort to ensure statewide that we have core public health services provided in every jurisdiction, and that those core services meet a set of updated standards. I think in Washington, this is called Foundational Public Health Services. So it's a very similar idea. And the legislature has been sort of funding it bit by bit over the past few years. So since the 2021 heat dome, the legislature has put a lot of resources into the climate and health portion of public health modernization. This graphic that you see on the slide kind of distills this big body of work into one image. You can see down at the bottom at about 6 o'clock on this wheel, you can see climate change is just this tiny piece of public health modernization. But it was resourced in, I think it was the 2022 legislative session. And that was really in response to the 2020 wildfires where we had the worst air quality on the planet. And a lot of folks lost their homes, their livelihoods. Some people lost their lives. And then the next year, the 2021 heat dome, where, as Resham described, we found ourselves underprepared for such an extreme event. What this has meant is that now every local public health jurisdiction, every county health department, has some resources to work on climate and health. It's modest in Multnomah County, which is the county where Portland, the state's largest city, is. It's the most populous county. We have 2 full-time equivalent staff members now working on climate and health. So that gives you a sense. But that is workforce that is now in place that was not there before the 2021 heat dome. I'm going to roll through a handful of policy changes that have taken place. A lot of these are at the state level, but they of course they play out in a lot of ways. The slides, I have to apologize, they're a little bit boring. I made them while I was recovering from illness, but I think the story they tell is pretty interesting. So, first policy change is Oregon OSHA adopted, I think this is in 2022, Oregon OSHA adopted permanent rules protecting workers during extreme heat. And I did take painstaking effort to go through and make sure that I had Celsius thresholds in here for each of these slides. So you're welcome to our friends from the north. Um, so that was for the first time we have protections for workers. Then they kick in at 80 degrees Fahrenheit, 27 Celsius. And those protections are things like regulating the frequency of rest breaks, availability of water, shade, so on. Another policy change that happened at the state level is oh, here's a mistake. It should be SB 1536, Senate Bill 1536 from the 2022 legislative session, established a right to cooling in residences. And that's important because we had, for example, landlords or homeowners associations prohibiting the use of especially um, um, portable heating and cooling units like window air conditioners or heat pumps. So this bill establishes a right for tenants to use cooling devices. Um, it also requires that new residential construction permitted after April of 2024 include one space that can be kept at 80 degrees Fahrenheit, 27 Celsius. In Oregon, we have a patchwork of utilities that provide electrical and gas service. In the Portland metro region, those are mostly investor owned, so they're not public utilities, which means it takes a Public Utility Commission policy change to initiate, new programs, new changes, and that successfully came to pass. So we have new programs uh, that assist low-income ratepayers, which we were finding, and we continue to find that the cost of running air conditioning is a barrier to people using this life-saving intervention. So this is one strong justification for these low-income ratepayer assistance programs. So that's now the case for our local utilities, and there have also been strengthened rules about avoiding power shutoffs during or directly before an extreme heat event. This is a very much a county level policy decision, was to sue the oil majors. Damages that we incurred during the heat dome and for future damages that we expect from continued climate change. The county filed a lawsuit in 2023 against all the major fossil fuel companies. And this is a photo of our Board of Commissioners marching from their offices to our courthouse to file the lawsuit. So we've talked about workforce, we've talked about policy, and now I'm going to talk about a few infrastructure changes. And this one actually straddles the line between infrastructure and policy, because it's a change in policy that has enabled more households to get cooling. So Oregon has a Medicaid waiver that allows that we negotiated with the federal government, and starting March of 2024, there are new climate benefits for folks on the Oregon Health Plan, which is Medicaid in Oregon. And those include access to air conditioners, air cleaners, heaters, air filtration, and refrigeration, and then also backup power supplies if folks have medical equipment or cooling needs. Um, and so that started in 2024. I will say prior to that, there was sort of the flexible funds within Medicaid funding could provide some patients with air conditioning or a heat pump in their home. But that was kind of on a individual case by case basis. And this is more like an eligibility. If you meet the eligibility requirements, you get the benefit. I think we've had big changes in our response infrastructure. Um, and you know, I will say before the 2021 heat dome, our cooling centers looked mostly like extended hours at senior centers, and we would see single digit attendance. During the heat dome, we activated 24-hour cooling shelters and hosted hundreds and hundreds of people. And now we have a much more robust capacity to set up these shelters on short notice. We have agreements in place with facilities all over the county. We have trailers full of supplies that are ready to go and deploy. We have staffing plans. Um, and and that's just for our cooling centers, but there are a lot of other interventions that we have as well, and a lot of um, more sophisticated emergency response and planning with all of our partners, and that includes the National Weather Service, where we have a strengthened partnership, and we're now working off of the heat risk tool that I think King County is also working with for planning our responses. So lastly, before I hand it over to James, there have been multiple programs at the state, county, and city level that have provided a lot of cooling devices to households. Um, in my view, it's such an influx that it makes it hard to really estimate the prevalence of of cooling in residences in Multnomah County. I don't think anyone has a firm handle on just how many households are with or without at this point. Um, I think one great example from the county is, we did a region-wide data collection effort where we measured air temperature to identify heat islands. That revealed a hot spot, a heat island in Wood Village, which is a sort of an outlying suburb of Portland. It's a small town, but I think it's majority Latinx. It's also home to a lot of mobile homes and manufactured homes. And when we looked at our data, we saw this hotspot and we spoke with the city manager there and kind of brainstormed some things that we could do. And in very short order, we were able to get resources from our county's weatherization assistance program to install heat pumps in a whole bunch of the mobile homes and manufactured homes in Wood Village. It was a real success story, and it happened on a timeline that I characterize as lightning fast for government. But I think maybe the biggest assistance program for this is Cooling Portland, which is from the Portland Clean Energy Fund, which I will invite my colleague Jaimes Valdez to talk about. I'll pass it to you, James.
Great. Thank you, Brendon. I'm going to go ahead and switch over to my slides real quick. Just a moment. All right. Hopefully this is working. Are you seeing my slides?
Yes, we are.
Yeah, thank you, and great to be with you all today. My name is Jaimes Valdez, he, him, with the City of Portland's Bureau of Planning and Sustainability, where I work on a program called the Portland Clean Energy Community Benefits Fund. That's the whole name, and really community benefits are core to our program, but we usually do abbreviate it as PCEP, or Portland Clean Energy Fund. This resource and amazing program within the community is made possible by really work that happened in 2017, 2018, and before in communities of color and low-income communities coming together to create a dedicated funding source for climate action and social justice within Portland. And so without getting into the entire backstory and history, this program became real on the November 2018 ballot. And then we've, over the last 5 years, been implementing different programs within the Portland Clean Energy Fund. One of them that was launched in response to that deadly 2021 heat dome event was our Cooling Portland program. And so I'm going to share with you just some very brief kind of highlights and overview of the program and what we've done here in Portland, Oregon to really address the need for cooling devices in people's homes. And we know there's a lot of different approaches needed at different scales to keep people cool and to address extreme heat in the face of climate chaos and increasingly hot summers that we're having here in the Northwest. But we have a 9-person committee that oversees the Portland Clean Energy Community Benefits Fund, as well as the City Council, which ultimately decides on funding allocations. And in the wake of those deadly and tragic deaths that we had in 2021, there was both an opportunity and a recognition that our program could do something to help provide cooling for people that needed it. And so we came up with kind of these initial goals of the program as we were designing it at the end of 2021. And I'll talk through them and kind of what our response was in program design. And then I'll talk about how implementation has gone over the last few years. So we really were looking to the data that Multnomah County and folks like Brendon provided in terms of who was most at risk, or where were the people who lost their lives, and what were the situations in which they had either in terms of housing or other vulnerabilities. And so what was identified was that it was a risk factor was being 60 years or older, living alone, and people with pre-existing medical conditions. So we targeted our program to meet kind of those vulnerabilities and focusing on low-income Portlanders, those who were not otherwise able to purchase a cooling unit. We have guiding principles within PCEF of being justice-driven, accountable, community-led, and focused on climate benefit with multiple or climate action with multiple benefits. And so we designed our program around that, really incorporating community-based organizations in the deployment, learning from things that have been happening already in terms of mutual aid, and really developing a program that was focused on full service to the community rather than just dropping off units. We developed a pretty aggressive timeline. Really, we wanted to be able to have units going into people's homes by the following spring, or definitely by the summer, and set this May-June 2022 date with the recognition that it was going to take time to ramp up and that we needed to plan for a multi-year program. In our grant making, we have the authority to do 5-year grants, and so we made this a 5-year program. When we started, we had the goal of installing and delivering 15,000 heat pump cooling units to people's homes, and really focusing on units that were both very efficient as well as provided a range of features that were needed in order for them to be useful for people. And so that was initially 15,000, and happy to report that we've been able to expand that since. We wanted to make sure we were not just giving the kind of, I guess, cheapest equipment that was available, but installations that also were professionally done, recognizing that we were dealing with a lot of elders, people who might not have the resources to do the installation themselves. So we wanted to make sure they were installed well, that the units themselves were as efficient as possible. And also, as Brendon had mentioned, being able to connect people with resources like those utility bill discount programs to lower their energy bill. And then we also looked to education and being able to provide a way to make sure that people knew how to use the units effectively, how to maintain them, and also that they were low maintenance units to begin with. So in our Cooling Portland model, we have a variety of kind of different roles. We as the Portland Clean Energy Fund are really the grant managers and funders of a program, which is then implemented by amazing community partners who are on the ground doing this work in people's homes. It's not the city itself going and installing and delivering, but rather community distribution partners, which are nonprofit organizations throughout the community that have really built up the capacity to do amazing work in this space and logistics of picking up units, scheduling deliveries with recipients, and then doing the installation, documenting that, and reporting back. We then have Earth Advantage, which is another nonprofit organization within here in Portland. This is our logistics or kind of equipment purchasing and management partner in this, and they really do all the work of coordinating the acquisition of equipment, working with warehouses to store it, managing the payments, and the I guess structure of accountability with community distribution partners, providing installation guidelines and information and training all the different people out there in the community doing this work. And so they have a team of folks who then work with each community distribution partner to make sure they have what's needed to do the installations and also manage a huge database of where and when installations are happening. And then ultimately the recipients. These are income qualified Portlanders who are receiving the units and being able to then keep their space cool and more manageable in our ever-changing climate. So just real briefly, kind of the program evolution and a lot of lessons we've learned along the way is that, we launched by our deadline in June of 2022, and there was incredible demand from the very beginning. And we were able to, with the first round of cohort of community partners, install over 3,000 units that first year. But it was very clear at the time that there was an immense need out in the community and that we also needed to do some expectation setting with community partners. When we launched this program, we called this the PCEF Heat Response Program. And while it was indeed designed in response to extreme heat, that really created a unreasonable expectation that when it was hot, this program was immediately going out and delivering units to people's homes. And the reality is, this is more like a few week time period between intake and somebody kind of getting into the system and then them getting scheduled and on to an installer to be able, and to community partner, and then on to an installer to come to their home to deliver a unit. And so we changed the name to Cooling Portland with the tagline of a PCEF-funded climate resilience program, and changed a lot of messaging to make it more clear that this is about being prepared ahead of a hot summer, and really encouraging people to sign up earlier in the year so that installations could start in the spring and ramp up as it was getting into the hotter season. We still do have people and community partners installing year-round, including a peak that does happen in the summer, but we wanted to be really kind of setting those expectations that this is a year-round program to really mitigate that peak intake. We also changed some processes in 2024, being able to bring on our 311 public information partner that provides information generally about programs available at the city to do the intake. Previous to this, we had each community partner doing their own individual outreach and intake, and they still have the ability to do that, but we wanted to be able to centralize things to create one point of contact for people rather than them having to call potentially 6 or 7 different partners. And now we have a total of 15 different partners who've been in Cooling Portland over the course of the program. Given the success of the program in 2024, we also were able to add budget to our program and expand the installation target to 25,000 units total over our 5-year program. And I know we have some other content to get through, so I'll wrap up and just share that, this has been an amazing success and served so many people out in the community. We're almost at 20,000 units distributed and installed. And there's just some amazing stories from recipients who've been super grateful and have shared how the ability to have cooling in their home during these hot summers has really been transformational in the way that they've been able to live their lives or be able to be more comfortable. We are wrapping this program up, however, in the end of 2026. And so we are both ahead of schedule, and we only have one more year of the program. And so we're now planning for, well, what's next? What can we do to more permanently be able to serve people with cooling? And really, how can we learn from this program, the direct community service that so many organizations have provided, to continue supporting people through these extremely hot summers, knowing that some people still will need access to cooling that don't have it. And so I guess I'll end there. We can talk more in Q&A, but it's been an amazing program, and super grateful for all the partners who have made it happen out in the community to serve Portlanders. I'll go ahead and stop sharing.
Thank you, James. Thank you, and Brendon, for kicking us off in this lessons learned webinar today. With that, and I see folks have joined me in thanking both of our speakers, and we'll turn to our partners in British Columbia. I'll turn to you, Michael Schwandt from Vancouver Coastal Health and Katia Tynan from City of Vancouver.
Great, and hopefully you can see the presentation here. If you could give a thumbs up if you're able to see it, and if it's in presentation mode, that would be most helpful.
I'll give you a half thumbs up, Michael. I can see your screen, but you may want to go to the slideshow mode. There you go.
There you go. One thumb up is good, but I'll aim for two. First of all, thanks for the opportunity to join with you. Really excited to be speaking in conversation with our colleagues in Washington and Oregon. My name is Michael Schwandt. I use he, him pronouns. I'm a medical health officer with Vancouver Coastal Health in British Columbia.
And hi, everyone. My name is Katia Tynan. Pronouns are she and hers, and I'm the Manager of Resilience and Disaster Risk Reduction with the City of Vancouver.
Thanks, Katia. And just as a territorial acknowledgement, both Katia and I are presenting on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. I should note Vancouver Coastal Health serves a larger region and actually supports public health and health services for people on 14 different First Nations in southwestern BC. And then if there's anything that you'd add, Katia, we just wanted to note both of our organizational territorial acknowledgements here. I think this is very important in topics related to environmental health. We often note that climate change and health has been driven to a large extent by colonial processes. Further disproportionate impacts on Indigenous people in our communities are due to those processes and ongoing systemic racism. So I think it's very important to make this acknowledgement in our presentation. As just a bit of a background, and I know that we have audience members in the US, here in BC, and right across Canada, I'm delighted to see. So thanks for joining some of my Canadian colleagues elsewhere in the country. And because public health and municipal services variously organize themselves a little bit differently from place to place, of course, just wanted to provide a little bit of context for how we operate here in Vancouver. As I mentioned, Vancouver Coastal Health provides services for areas outside of the city of Vancouver, but including that includes most of our health systems, so hospitals and public clinics and community health services, as well as supporting emergency management in the health system, along with provincial partners, and then provide health guidance and data for a lot of different groups, both governmental and non-governmental, that provide not necessarily health services, but health supporting services. So many of the determinants of health that are supported by municipal government. We're also a regulator of a variety of important health impacting services like childcare and so forth. I won't read out all of the provincial government supports. They're very important as well, not least of all by funding our health system, but are also responsible across the province for sectors including transportation and housing, and do support us to a great degree in our emergency response planning. And then maybe Katia might touch on the City of Vancouver's work.
Yeah, absolutely. So municipalities here are often referred to as creatures of the province. So the things that we have responsibility for are local land use planning, civic infrastructure, critical infrastructure like sewers, roads, and bridges. We also do a lot of work on parks and recreation centers, libraries, community centers, and other social infrastructure. We, of course, do emergency management at the city, while response funding actually does often, but not always, come from the province, and manage police and fire services.
Thanks, Katia. And yeah, very happy to be working closely with the City of Vancouver. In spite of having these, I find delightful colorways that are almost identical, the organizations are completely separate organizationally. So it's been very good to be able to work together on health-related topics over many, many years. 2021 BC, the heat dome, all of you will have experienced or certainly be aware of it, but just a bit of context. Obviously the temperatures and the duration and intensity were unprecedented within British Columbia, in particular in the southwestern part of the province. We had 619 heat-related deaths in the assessment of the BC Coroner's Service, over 400 of those in the Metro Vancouver area, and 117 within the city of Vancouver in particular. The analyses have found that most people did pass away, unfortunately, in their home, and the majority of those were older adults who were living alone at the time of their deaths. Found that the paramedic service was quite overwhelmed within the province, with the number of people requiring assistance, and certainly emergency rooms were impacted as well. A coroner's report subsequently identified 14 main recommendations across 3 categories that we hope you'll see resonating in the rest of the presentation for a report of this nature to be released, really reserved for emergencies and really major mortality events within our province or ongoing issues. So it's somewhat binding to government, whether at the provincial or local level. Organizations like ours really answerable to these recommendations. So it's quite important that these recommendations were delivered. And just for a little bit of further context, extreme heat is not the end of the story in terms of climate change and local impacts here in Vancouver. We've seen, as well as extreme heat, even in 2021, and wildfire smoke, drought, and that major atmospheric river causing flooding right across our communities here. So this is a topic more generally that we're attending to very closely, and you see that in both of our organizations' ongoing work. It actually became the topic of our Chief Medical Health Officer's annual report that was released just over a year and a half ago, and the City of Vancouver as well has a climate adaptation strategy, a climate change adaptation strategy that's really provides overarching guidance. So just in terms of the organization of this presentation going forward, we'll really look at some of the immediate seasonal readiness work that was accelerated following the 2021 heat dome, and then get into some of the longer term policies and plans that we're hoping to discuss with you today. So first and perhaps foremost, I think that after in the aftermath of the heat dome, as well as some of the more statistical reports that you saw at the BC Coroner's report I referenced earlier, there's a lot of effort to try to understand the lived experience of different communities during the heat dome and through other climate-related events. So we saw some of these provincial reports. I won't detail the organizations commissioning and carrying these out, but these flowed from both provincial government, from the not-for-profit space, as you see in the middle, from the Aboriginal Housing Management Association, and our own organization as well. And through more formal processes like that, as well as our ongoing practice, we really tried to ensure that some of the efforts that we have are flowing from community needs and experiences. One of those demands that we've experienced is just more information. We see with a variety of actors, we often describe that climate change requires an all-of-society response, and we've heard from some of those elements of society, whether that's childcare, as you see here, operators of buildings, people who run special events. And I'd highlight in the top right corner there, people who can operate cooling centers, not just municipal government with some of their larger and very important cooling centers, but also small non-governmental organizations who are able to provide, in some cases, cooling spaces right within their own operations that are very welcoming to people who might be accessing those spaces day to day and week to week at baseline, so that people aren't required to go to a completely new space during a time of emergency. So we've tried to provide guidance for those sorts of spaces who've said that they'd like to do this, but they want to do it in an evidence-based way. One resource that we'd like to highlight is both this heat check-in support framework that we've developed, again, in response to community requests from groups that were saying that they were, during the Pacific Northwest heat dome, knocking on doors, phoning people up who they knew were at risk among their membership. These are not necessarily health-related NGOs, but NGOs providing a whole variety of different services, but aware that some of their participants, clients might be at risk, but saying that in order to do this effectively, they'd really like to have some good support, in particular from public health. So we tried to respond to this by developing a whole variety of different resources. reasonably user-friendly, we think, guidance for both by the phone and in-person check-ins with community members, trying to leverage social connection in our communities to help to, one, identify if people need support cooling their spaces, and if people do need health care or medical assistance, how that can be deployed. So allowing community volunteers and staff people who might not be health personnel to work in a confident and evidence-based way. And this is something we're actually pursuing an external evaluation with academic partners of right now. This has been running for a few years, so we'd like to know, are there things that we can do better or continue to improve? Hand it over to you, Katia.
Great, thanks, Michael. So a pretty significant body of work that's taken place since the heat dome is improving our communication around extreme heat. So recognizing that there are many folks in our community who didn't really see this as a critical issue before the heat dome are starting to now. We do a lot of work on pre-season and during extreme heat event messaging to make sure that we're providing folks not just with guidance around what they can do, but also really laying out the risk factors. And we've worked really closely, of course, with our partners in health and Michael's team, who are the experts in that, to sort of amplify that public health messaging. In addition to that, we're trying to do a lot of work, both our agencies, to tie heat events to other kind of public policies we need to support around climate action, right to cool, equitable green space, et cetera. And I think a pretty significant shift in our heat messaging since the heat dome has been, for the city of Vancouver at least, during the heat dome, our extreme heat messaging was only provided in English. And since then, we actually now translate all of our extreme heat information into the top 12 languages in Vancouver. So recognizing that we actually need to provide information in multiple languages through multiple platforms and formats. So not just social media, but radio ads and other places that are going to reach different folks in our community. And while I work in the urban environment, I would be remiss without mentioning that my colleagues in health also do a lot of work to make sure that messaging is geographically relevant, really thinking of the difference in messaging around extreme heat between urban and rural communities. So in addition to that communications work, there's sort of two buckets of infrastructure related seasonal readiness work the city of Vancouver has taken on. So we have had heat infrastructure in place for over a decade now, but the heat dome has really accelerated and deepened how we're applying that and approaching that. So we do have outdoor pools, spray parks, and other kind of permanent infrastructure in the city. But each year now we also do deploy misting stations, fountains, and help and work with community partners on establishing shaded parklets in neighborhoods that have less access to shade and green space. So really trying to sort of expand outdoor cooling in public spaces across the board and do evaluation every year on kind of what are the locations where we should sort of deploy that temporary infrastructure, recognizing we really want to get it to places that are reaching people who need it most. In addition to that, of course, there's our indoor cooling work as well. So establishing cooling centers and doing, again, a lot of public messaging around this. So at the present time, we have roughly 38 cooling centers across the city of Vancouver. So again, not a new initiative, but a deeply expanded initiative from where we were at prior to the heat dome, and are always trying to kind of look at improvements to making sure that all of our civic facilities actually have cooling during the summers. Now, on the other side of this work is really looking and digging into more of the social supports that we need. So the City of Vancouver owns and operates a small number of non-market housing buildings, and staff from those every year now do kind of monitoring and check-ins for people who are living in those buildings or establishing cool rooms within them. We also are providing funding to organizations like the SRO Collaborative, who works with private single residency occupancy buildings. So again, wanting to make sure that there's support for NGOs that are the ones kind of on the ground doing the work with tenants in these buildings and kind of improving the tenant access to cooling within them. In addition to that, we work a lot with all kinds of community-based organizations. I'll talk more about that in a bit, so I'll maybe put a pause there. And of course, public information, multilingual messaging, multi-platform messaging around extreme heat leading into and throughout the summers. And then we have a couple of kind of somewhat unique initiatives, I think, in Vancouver. So one of which is the Cool Kits program, which really resulted from some feedback we received from people with disabilities in the aftermath of the heat dome, wanting kind of low-tech, low-barrier supplies they could keep at home if they didn't have access to air conditioning. So we worked with our partners in health to figure out what would those items be, procured them and distributed them through community partners. You see an image of that on the top right-hand side. We built off of this work and then started thinking about what other kind of portable devices or supports we could put in place. And so the top right or left-hand image is of our cooling vest project. This is based off of research conducted by Praxis Spinal Cord Institute on people with spinal cord injuries and extreme heat. And we work every year now with an organization called Technology for Living that supports people with disabilities on distributing wearable cooling devices, recognizing that in addition to needing cooling at home, people also need to be able to go about their day-to-day lives during extreme heat events and throughout the summers. And then the sort of last bucket, I would say, of work that we've been doing is on kind of creative and DIY or do-it-yourself engagement around heat. So some of our partners are crocheting shade canopies to kind of add shade within their neighborhoods or within parks or other spaces. We have partners who we've been working with on do-it-yourself misting stations, that bottom image there. And of course, one of our programs is on DIY or do-it-yourself air cleaners for wildfire smoke. So a bit kind of tangential to the extreme heat conversation of the day, but really wanting to put tools in people's hands and opportunities for folks to come together, socialize and socially connect, but also get in place supports for themselves and the people they care about around extreme heat.
So shifting from some of the work that's gone on more immediately following the heat dome to some of our longer term work, and now noting, of course, that those are not totally mutually exclusive categories. But one thing that you've heard us say a few times through the opening slides here has been a reference to this right to cool, or the idea that everyone should have the opportunity to access cool and clean air within their own home, which we know is not the case with our existing housing infrastructure. There's been a number of different policy analyses, one by Vancouver Coastal Health, certainly a very interesting look at this through an energy justice lens by a Canadian non-governmental organization, EcoTrust, and other bodies as well, looking at some of the policy approaches, most of them coming to the finding that this is extremely complex. We have regulations and legislation at the local, provincial, and federal level that affect this issue, and this could relate to the construction of buildings and their maintenance, the relationship between landlords and tenants, and a whole swath of different opportunities for intervention with healthy public policy. But there's not too many single strokes that are going to solve this problem all at once. That said, a few positive things that we have seen. We've seen support for retrofit incentive programs for people to add heat pumps, whether to their own home if they're an owner of a single unit or a single house, or in some cases for landlords to be incentivized to reduce overheating through access to retrofit programs as well. As well as that regulation looking at the very requirement for cooling or having performance-based requirements for housing to provide cooler spaces is something that we've seen at the local and provincial levels. I'll highlight locally, the Vancouver Building Bylaw is actually requiring mandatory mechanical cooling for new multifamily buildings. So basically apartment buildings 4 stories and up, in short. And that's a pretty recent policy change. And then province-wide, the BC Building Code going forward requires that new homes will provide at least one space within the home, not necessarily the entire apartment or house, that doesn't exceed 26 degrees Celsius or 79 degrees Fahrenheit as a threshold that has some health-related evidence for it. So naturally, viewers will note that this does not cover, to some extent, existing homes. We've got the policies that affect new builds. We know that the overwhelming majority of people naturally will be living in existing housing for quite some time as some of that housing ages out. So it's very important that we continue to look at policies, again, for example, for people who are familiar in Canada with the Residential Tenancies Act or similar policies, I'm sure in the US exist, that govern the requirements for a landlord to provide tenants with cool spaces. That's an area of policy advocacy for us currently. BC Hydro's free air conditioning program is something that's run over the last few years. It's delivered around 22,500 units across the province. Initially was open to both public and health system referrals, so people could self-refer, and it was an income-tested program. In the last year, this has been available through health system referrals only. I think that there's been, my understanding is an effort to ensure that this finite resource is directed to where the need might be highest in terms of health-related risk. Naturally, we would advocate that people, even without a diagnosis that might qualify them for this program, should be able to access cool indoor spaces as well. So, there's definitely reasonable debates over the eligibility criteria, and we were able to engage with BC Hydro, which is a Crown corporation, which is to say it's publicly owned and operated here in BC, over some of the particulars of the program. So, for example, initially this was available to people in home care and home health programs who are important and potentially at-risk group, and that's been expanded to mental health and substance use programs based to some extent on the evidence from here in BC on the elevated risk among people using substances, people with schizophrenia, and other mental health conditions during the BC heat dome. So we've been pleased to see a responsiveness from this policy. Some of the very thoughtful people engaged with it with this program. A couple of things within Vancouver Coastal Health. Knowing the importance of the non-governmental space in action for climate change adaptation, we've developed within our longstanding health promotion grant program a climate adaptation stream of that. This is to fund organizations that are engaging in extreme weather planning in many cases, or climate change adaptation more generally. We've listed some of the potential applications of that, and that's gone from developing a long-range plan from certain organizations, or things that are a bit more concrete and physical, like air cleaner workshops, or simply acquiring heat pump or air conditioning for a building that an organization operates out of. I'll briefly mention our indoor heat study. This was just something that was initiated actually the summer of the very summer of the heat dome, and we had another smaller heat event not long after that, studying people's experience with their indoor temperatures, finding, perhaps not surprisingly, but very important to put data to it, I think, in terms of policy advocacy, that renters were much less likely to report having air conditioning than homeowners, but neither renters nor homeowners were particularly likely to have it, certainly a minority position within our jurisdiction here in Vancouver. This was work between the City of Vancouver, Vancouver Coastal Health, and I should mention our colleagues at BC Centre for Disease Control. This characterized a variety of different risk factors for high indoor temperatures, as well as protective factors, some of those including air conditioning, but also a lot of passive cooling steps that we've really tried to disseminate and share both with cities and with developers of housing. I'll hand it back over to you, Katia, for the final stretch.
Thanks, Michael. So coming back to that community partner bullet from earlier, one of the ways that we do this is through something called the Resilient Neighborhoods Program, which we've been running at the city since 2017. This program is really predicated on the notion that during crises, people go to the places they know and trust to meet their needs. And oftentimes that's not necessarily government-run facilities. We look in this program at sort of the intersections between equity, climate adaptation, emergency preparedness, social connection and belonging, and then work with organizations. And we have a grant program in place for this to build on the services and networks that enable them to thrive day to day, and then consider how we transform these to meet different needs, community needs during crises. So earlier on, you heard about the Heat Wellness Check Guide. That's a prime example of organizations who are doing those kinds of wellness checks and then just need a bit of support for both colleagues in health and us to help them actually conduct those wellness checks and sort of, again, transform those day-to-day services during a crisis. Next slide, please. So just kind of a snapshot of some of the actions that our community partners have been leading over the last 3 years since the heat dome. Wellness checks have been a big part of their work. Many of them have been planting trees on their properties and engaging youth to do that. Installation of air conditioning and heat pumps, not just in their facilities, but also in the housing that they might operate in some cases. crocheted shade canopies, which I mentioned earlier. In one really incredible example, the Aboriginal Friendship Center established some work to pick up Indigenous elders and take them for land-based cooling in forests and lakes, again, kind of intersecting with Indigenous health. Activities in cool spaces, so doing things to make cooling centers less boring and keep people there for longer, like movies and food. DIY misting stations. Many of our partners do multilingual and culturally appropriate engagement, so using peer-based models and multilingual workshops and other ways of getting information out about heat. And in the case of some of our partners, really sort of bringing together this intersection of extreme heat first aid training and harm reduction training. And maybe next, I'll also just touch on, it's not just the social programs that are in place, there's also kind of an influence of the built environment on the social environment. So both Vancouver Coastal Health and City of Vancouver work with Happy Cities and Hey Neighbor Collective, trying to understand how we actually design for sociability within our environments. And that's certainly long-term work that we're trying to do to make sure that social connection is just part of the fiber of our city. And then last, but certainly not least by any stretch, one of the really important bodies of work we have is around natural areas and green space, both protecting our existing tree canopy, recognizing that climate change is having pretty significant, and I would say development too, sometimes having significant impacts on trees and green space, but then also expanding green space. So recognizing that historically we have certain neighborhoods that are underserved by green space, both by way of tree canopy, but also parks, and trying to kind of improve upon that, and sort of implementing climate resilient green infrastructure, both at the street level, thinking of sort of dual benefits for extreme rainfall, but also at roof levels and thinking of those benefits for reducing sort of ambient heat in buildings through green.
Yes, thanks very much. Of course, we're looking forward to the conversation and the breakout groups. And as well as that, you can, I'm sure, reach out anytime at all. We've got our contact information there. And thanks again for the opportunity to talk with you.
Thank you, Michael and Katia. I really appreciate that overview. Really robust, lots of programming that you were able to share with us and highlight. A reminder for all, we are recording this session and we'll make that available for those who are interested and were inquiring. Therefore, we have our chat disabled, but as you've seen in the chat, you can ask questions of the speakers. Highly encourage it. You'll find a Q&A button on the bottom of your Zoom features. You can add in any questions that you might have, and we'll try to answer some live, as you can see, and others we'll reserve till the end of the last set of presentations here. With that, I will turn to our next set of presenters from the King County area, Daaniya from King County Executive's Climate Office, and Catherine from Public Health Seattle and King County. Over to you both.
Thanks.
And then following the set of presenters, we'll open up for responding to a few of the questions that have come in. So please do continue to add your questions using the Q&A feature. Over to you.
Thank you. Go ahead and get our screen set up. Thank you all so much for joining us today. I'm going to hand it to Kat for our intro first, and then I can kick us off afterwards.
Thanks, Daaniya. Hi, I'm Catherine Hartwell. I'm with Public Health Seattle King County. I'm a project manager with the Climate and Health Equity Initiative. I use she, her pronouns, and looking forward to the conversation today. Back to you, Daaniya.
Thanks. Hi, everyone. My name is Daaniya Iyaz. I go by she, her pronouns. I'm the Climate Preparedness Project Manager in the King County Executive Climate Office. So also the county with Kat, just in a different department. But really excited to talk about a lot of our planning and how things have changed since the heat dome. We also wanted to touch on some of the concepts from the research and action agenda. What we've been putting a lot of our time and focus on after the heat dome is really understanding collaboration. So how our community partners and our at-risk residents been experiencing heat, what kind of solutions are accessible to them. We've also been focusing a lot on communication, so raising awareness, especially since we are a primarily cool climate, and then also thinking about how can we strategically unify across agencies, local jurisdictions, and our community partners when we think about preparedness and response planning. So I know everyone's done a really great job of kind of giving an overview of the heat dome. So I'm just going to go go through a couple of slides that provide some context, what it was like in our region, and to better understand what exactly we're planning for. So for the heat dome in 2021, that was the most deadly weather-related disaster for us in the state of Washington, as many other people and areas have experienced as well. For us, we definitely noted markedly more mortalities in King County, about 34, and more than 100 across the state, with more increased hospitalizations. And similar to what Michael mentioned for BC, we are also facing a lot of the similar co-occurring hazards, like when we're seeing wildfire, when we're talking about drought, when we're also seeing more blackouts and brownouts. And there are a couple of other infrastructure related damages that we noticed. Like, for example, on the bottom right, during the heat dome, we had Seattle Department of Transportation spraying down the bridges to keep it cool. Also seeing increases in drownings, since our bodies of water are really cool and people are not always prepared for that when they go swimming when it comes to extreme heat, as well as some more agricultural damage that we're seeing for a lot of folks working in that industry in our area, and things like stream health impacts as we see higher temperatures, which impact salmon. And we're also seeing that this is not really changing, where we're seeing average air temperatures have been increasing our region and also projected to be about 5.5 Fahrenheit warmer or degrees higher in the 2050s as well. And here I just wanted to share our heat map that we did in 2020 for a heat mapping study, just to provide some further context for where we're focusing a lot of our planning and preparedness efforts, though of course we are looking at it countywide. So over on the left, just looking at where we're seeing a lot of the extreme heat, it is focused on South King County, where we've got a lot of our industrial corridors, less urban tree canopy, a lot more of our different populations. That also overlaps with our environmental health disparities map, which you see on the right, where the dark red is communities that face more disparity according to things like pollution exposure due to highways and roadways, things like socioeconomic status, as well as underlying health conditions. But we also wanted to note that in Eastern King County, we have some communities that are considered more rural, but they're still experiencing heat islands too. So just figuring out how can we really plan more holistically when we talk about extreme heat. And then over here, we wanted to note some intersecting challenges. After the heat dome, we made it a concerted effort to do a lot of community engagement as a part of a strategy that we're developing, or developed, that I'll go more into. But we just heard about a lot of intersecting challenges beyond just immediate heat response that we needed to plan for, such as the lack of accessibility to cooling technology. We heard cost of operation, also complexity, especially for communities that are limited English proficiency. We also heard about things like lack of transportation, even if resources or cooling are available. And we heard about safety concerns for self and pets when leaving the home, depending upon where people are. And we also heard about things like lack of access to things like water or bathrooms or cooling locations, as well as social stigmas that people experience. So this really informed a lot of what we wanted to think about when we were talking about planning after the heat dome. And a couple other things that I wanted to note too is things about like co-occurring hazards that really came up. So folks saying that things like outdoor air quality, but also indoor air quality, really compounding the impacts that they feel of extreme heat, or things like feeling like they couldn't open a window just because air quality was not the best. So seeing how we can plan for multiple hazards. So what I wanted to move on to is how our response planning has adapted since the heat dome. So in general, we released more extreme heat response plans or updated existing ones. A big one that I wanted to highlight, since Kat is also on the call, is the extreme heat response plan from Public Health Seattle King County. It was updated in 2022 based on the heat dome. And one thing that we've done with a lot of our partners, such as King County Office of Emergency Management and King County Regional Homelessness Authority, is align the activation thresholds for the work and when they start doing heat response, which you can see on the right, the top right. It's based on National Weather Service's heat risk index. But it's been really helpful to have a unified activation threshold and recommendations based on those. The Public Health Heat Response Plan has recommendations based on each of those categories, ranging from when should communications go out to when should summer camps be closed down. And King County Office of Emergency Management also released a regional operational sheltering strategy as well that provides recommendations on extreme weather sheltering in both heat and cold. But we combined a lot of our outreach to better understand some recommendations around sheltering there. They also set up missing tents as well. And the Regional Homelessness Authority, like I mentioned, activates on the same thresholds, but they do a lot of a coordination of response for people experiencing homelessness, such as distribution of cool kits, as well as directing folks to resources such as extreme weather sheltering. So there is a lot that we have when it comes to response planning. But one thing that came up in our conversations with local jurisdictions in particular is, what about other partners beyond just the county, and what about long-term planning efforts? So that is where the 2024 King County Extreme Heat Mitigation Strategy comes into effect. Like I mentioned, we spent a lot of time on better understanding what folks would like to see and what resources are actually accessible. And after the heat dome, but also starting in about late 2023, we received funding from a FEMA Building Resilient Infrastructures and Communities grant to develop a heat strategy that essentially now contains 20 actions that are focused on some of those more near-term things that we talked about, but also goes all the way to more long-term planning. So what are we going to be doing around things like urban tree canopy targets or building and energy codes? And it's intended to be a 5-year plan. So to better understand what should go into these actions, we engage with over 900 folks across King County, including folks like service providers, local governments, community-based organizers, to come up with this 5-year plan that provides strategic direction for local and county-wide action, while prioritizing implementation in those heat islands that you saw earlier, though again, this is intended to be a county-wide plan. So here is just the heat strategy actions. I wanted to share this slide to kind of provide more context into what we're focusing on right now and what our priorities are. So the 20 actions themselves are split into 6 different strategic objectives, with the first category focusing on helping people stay cool and safe indoors. Since we heard from almost all of our engagement, for folks who are housed, they typically prefer to stay in place, whether it's due to convenience, whether it's due to cost, whether it's due to pets. So these actions really focus on getting resources directly to folks at their homes or building up trusted cooling locations. The second category is focusing on how we can support people who spend a lot of time outdoors, whether it's more drowning prevention actions, whether it's getting resources to folks who are unhoused, or focusing more on occupational heat safety awareness. The third category is focusing more on environment and kind of cooling neighborhoods. So the first 4 actions there really focus on bolstering urban tree canopy, while the 13th action, which is open space access, focuses on things like stormwater parks, for example, as well as preventing the creation of new heat islands. And the fourth category is thinking about how we integrate heat resilience into our long-term planning. So when we're talking about things like designing school campuses, updating building and energy codes, designing new parks and playgrounds or updating them, how exactly are we integrating heat resilience into that? And the 5th category is focusing more on those multilingual communications and heat preparedness trainings, which Kat will get more into. And then finally, the 6th category is us thinking about, now that we've released the strategy, what are we going to be doing about keeping momentum on this moving forward? So how are we going to sustain a network of practice around this work? And also, in all these actions that we've listed, while it may be comprehensive, it's not exhaustive. And there are a lot of things that communities have been doing to keep themselves safe. So how are we supporting that? And out of all of these, the actions that really came up from our community members as higher priorities is focusing more on category 1. So how are we getting resources to people where they are? Category 6, which is how are we supporting more community-led solutions? And category 5, so that multilingual communications piece. So that's what we wanted to focus on in the year since the release of the heat strategy. So here I wanted to go over some of the different pilots or things that we've been working on. The first, I wanted to focus on that preparedness and response piece that we have in the heat and research action strategy. So we just developed and released a heat and health data explorer tool, and you can see a snapshot of it on the top right. And the purpose of this tool is to better help people visualize heat islands, but also overlaps it and maps it with things like urban tree canopy, adults over 65, folks of below a certain poverty level, just to essentially help understand what areas are at high risk and plan for heat before it happens. We also worked with the climate equity team that's a part of our office, so the executive climate office, to contribute $30K to their community climate resilience grant, which essentially grants from anywhere from $5 to $30K to community-based organizations to lead and develop a climate project that drives climate resilience, however they define it in their communities. So we provided $30K to focus specifically on heat mitigation, and I went to an organization called Outreach and Transforms Lives that does programming for the East African immigrant community in South King County. So they distributed cool kits as well as held more community trainings about extreme heat focused in South King County. We're also currently conducting a pilot with Sound Generations, which is an organization that supports typically older adults as well as folks with disabilities to distribute cooling items directly to high-risk households that reach out to them for support, with a priority on folks that live in those MAPT islands. And finally, we also worked with other folks in public health where they led a project to install sunshades in family childcares, and they were able to use our tool to help decide where they wanted those sunshades to go in terms of the childcares that reached out to them. So those were all the activities that we really focused on this summer, based on what we heard on the heat strategy and from all of our partners. And for our next steps and priorities, we want to focus on that Heat Smart Parks and Playgrounds design guide. So really doing the background research and working with local parks departments to see what they would like in that. And we also want to continue advocating for heat resilient building and energy codes on the state level. That's based on what we're hearing from local jurisdictions that would be helpful and feasible to them, as well as existing research by nonprofits. So I will hand it off to Kat to talk more and go more in depth about what public health has been doing.
Thanks, Daaniya. When it comes to public health, King County responds in a few ways to extreme heat, which I'll discuss a little more in depth. First, we communicate to the public on the health risks associated with heat and protective actions that individuals can take. We also monitor climate data, including data specifically on heat-related illnesses in the county. And we also work with community closely on adaptation efforts, which is what I'm really going to dive into in my short time left here. But first, let me talk about communicating on heat. All of our climate communications are really focused on drawing the connections between climate change and health and broadly educating the community on how climate is impacting health. And the goal really is to provide actionable information so that communities can help reduce their exposure to the climate hazards, including extreme heat. And we aim to engage with communities in a relevant and accessible way so that messages can reach those most at risk. So in this example I have here, this is our Stay Safe in the Heat comic, which was co-produced with Dr. Tanya Bush-Isaacson and the team at University of Washington. And it's been translated into 13 languages. And this is actually, this past summer was the third year that we ran a campaign in community and in multilingual media outlets. Next slide, please. And sorry, Daaniya, that's the comic. I forgot to say next slide, but next slide, please. We'll just look at the data. Thank you. So as I mentioned, another way we engage on heat is through data monitoring. And this image is from our climate and health data dashboard, which came out in 2024. And the image shows how emergency department visits for heat-related illness vary based on demographics. And the charts don't really tell us the full story of what's going on, but it really helps us start to understand impacts in the community. Next slide, please. But what I'm going to dive into today is this climate and health adaptation modeling project, which I led last year. It is a pilot project based in the city of Auburn, which is in South King County and is one of the heat island communities that Daaniya showed you on the map earlier in South King County. And it was funded by a philanthropic grant and took place over the course of 2024-2025. For this project, we pulled together 15 community members with lived and or professional experience with heat health impacts in community. For example, we had older adults, we had someone from the senior center, we had someone from the food bank, which provides a ton of services in Auburn. We had community health workers, and a lot of our folks were wearing different hats and changing perspectives constantly. For example, we had someone who works in housing advocacy who was a veteran who had experienced a heat-related illness themselves. So they were constantly flipping perspectives to think about the heat drivers in Auburn. And so the work group came together for 6 half-day in-person workshops in Auburn. And together they have been using a process called, it's an evidence-based process called participatory group model building. And with this, they've identified local drivers of heat health and co-developed solutions specifically tailored for Auburn. Next slide, please. Thanks, Daaniya. So here's a snapshot of what we did over the last year. In our first workshop, we brought everybody together to really make sure that they were all working from the same place and knowledge of extreme heat and how it impacts health. In our second workshop, they came together and defined the problem that they'd be focused on for the rest of the workshops, which really was how is heat impacting health in Auburn. For the third workshop, you see there the wall with the drawings. They began mapping the variables in that group model building process, which is a form of system science. They basically created a systems map with arrows and connected dots. And using that systems map, that informed in workshop for the themes that emerged, which began to inform solutions. So we took a moment in between to talk about our framework for prioritization, which is called APPEASE. That framework stands for acceptability, practicability, effectiveness, affordability, side effects, and equity. And these work group members thought about each of those criteria and each of the solutions that were proposed. There were 34 that they considered. And we finalized it in that last workshop to the 7 that I'm going to show you now, which was really their top community co-developed solutions. So next slide, please, Daaniya. Thanks. So these are the top 7 prioritized solutions in order of their ranking score, which was quantified using that framework. And, you know, it's interesting that Cool Kits has come up in Multnomah County and in Vancouver, who's leading on this. Shout out to Vancouver. You know, they just really want these life-saving resources in community. And so that was our top solution. And it's great because King County Regional Homeless Authority is already working on getting those out there. Second solution they wanted was energy assistance. And so this is really similar to the program that Brendon mentioned, really working to alleviate the cost of energy for low-income households so that if they have cooling infrastructure, they're actually able to afford using it. The third solution was this idea of extending hours at the cooling center, because in Auburn, many of the cooling centers are only open from 9 to 5 or 8 to 5. And so making sure that, as we all know in this region, the evening is when it's still hot and people need a place to go cool off. Another thing that came up with this too, though, was the idea that Katia mentioned of making sure there's stuff at the cooling centers that people want to go there for beyond just space. So have incentivizing things to get people there. We also had this idea of heat education for workers. So sharing information on heat risk and strategies to mitigate that risk. For example, making sure that workers know the symptoms of heat-related illness, but also making sure that they know their rights, which were mentioned earlier, you know, water breaks and breaks at a certain temperature threshold. Community navigator programs were really popular. They already exist in King County. This is a way of getting cultural translators in community and helping individuals navigate certain social support services. And so our group really wanted to expand community navigator programs. And then community gardens was another top solution. We know that green space cools the surface temperature, but this idea too really came from that systems level thinking. Like when community members have access to local healthy foods, their overall health is better, prevents chronic disease, and that makes them more resilient to extreme heat exposure. And then finally, hosting opportunity circles, which is this idea of bringing together individuals to share stories and resources and learn from each other on different topics. And in this case, it would be heat. These can be led by community-based organizations or faith-based organizations or local government agencies. So next slide, please, Daaniya. And then finally, one thing that we created as part of the CHAMP project was a graphic illustrated story. And early on in our discussions with the community members, the champions, this idea of violence and extreme heat came up as a theme. People shared personal experiences of how, like, at parks and spray parks, fights would break out, and we heard all kinds of things. But we decided to focus on domestic violence, which was a topic that was shared as well. And we partnered with an individual who is a survivor of domestic violence to tell their story, as well as a couple of gender-based violence organizations in King County, just to make sure that our storytelling was representative. So this slide is the beginning and the end of the story. And we have a last page that has resources that we share out. And right now for this summer, it's been available in English and Spanish on our website, but it's been translated into 11 more languages. So there'll be 13 total. And we're hoping to get that up in the next few weeks, because also this story affects other extreme weather events, as the last panel sort of talks about too. So that's it for me. Next slide, Daaniya, and I'll pass it back to Daaniya to sort of close us out. Thanks.
Thanks, Kat. So just kind of wanted to, in summary for our region, I know a lot of what we found at the beginning was focusing on the fact that heat does matter in our region, and it affects different people in different places differently based on, personal characteristics as well as where people are located. So that really led to why we needed to do a mixture of those different strategies that we discussed in the research and action agenda. But for us, just in these beginning stages, it's been really focusing on who are those partners, how can we build community of practice with them, what are we doing about communications and awareness to start with, but also how are we translating that into long-term planning, as well as focusing on the preparedness and the response. So thank you all so much for your time. I know we talked about a couple of different resources, so they're here, but I'm also going to drop them in the chat shortly. But you're welcome to reach out to me and Kat using our emails below, which I will also drop in the chat shortly. So just thank you all so much for your time, and to our co-presenters for sharing all the great work they've been doing. And I'm looking forward to the discussion in the breakouts. Thank you.
Thanks, Daaniya. Thanks, Kat. Appreciate that. And yes, please do, speakers, presenters, continue to add any resources into the chat that folks might want to look at a little further. I think you'll all join me in reflecting in the sense that this opportunity in terms of learning from a tragic event and sharing our commitment to improving and exploring all that's been done over the last 5 years. Certainly a lot to celebrate and reflect on in terms of strategies and initiatives that the three regions have implemented, and especially when we think about sharing and learning across the Pacific Northwest. I heard a few kind of themes come forward. I'm seeing some questions in the Q&A feature being answered live as well, but a lot of conversation around cooling supports, policy and regulation, communications, and tailored solutions. I wanted to throw a question out to some of our panelists that pulls together a couple of things that came in via the Q&A. In thinking in particular in terms of shift in attention over time, beyond just any one intervention, how are you in your regions, as we take this nearly 5-year mark, seeing supports grow, or likely seeing some of the attention shifting away? I think, Michael, you started to answer one of those in the chat as well. But I wanted to know, have you had to think creatively or differently? You highlighted a few examples through all three presentations, as you kind of maybe are seeing less proactive supports and or resources in your jurisdictions. Kind of throw that out to any of our speakers or planning committee members.
I'll take a first pass at it. I think we talked a lot about assistance to households, so household level interventions for cooling, and for affording the bills for that cooling. I think many of those programs are starting to wind down, and the funding has gone away. Right, that was a response to an emergency. At the same time, I think there's a recognition that we're ready to pivot to something that's at more of a population scale, or something closer to it. So our team at Multnomah County Health Department is now looking at neighborhood level interventions for cooling. So with the idea that we identify basically heat islands and align resources there until those places no longer stand out as heat islands.
Yeah, thanks, Brendon. Kind of bringing it at a different scale. See if anyone else wants to add. If not, I'll throw a different question out there. Michael, go ahead.
I really appreciate the question, Patrick, and I briefly touched on in the text response that we have seen that. I think in the first couple of years following the heat dome, I think that describing some of our planned activities as responsive to the heat dome, to the coroner's recommendations, or to the climate emergency did garner quite a bit of attention and support for resource allocation from senior leaders. And I think, candidly, I think that it's not quite the same phenomenon we're seeing now in 2025, that resonance. So I think that describing, as we move away from that, a very singular emergency, but still existing within the emergency of climate change, communicating some of these ongoing impacts is really vital. And, unfortunately, we've seen a couple of things within British Columbia, like the BC Hydro, that free air conditioning program that I described, seeming to wind down without a clear plan for the next year, and at least not that's been communicated to me. So I'd definitely advocate strongly that the idea this was never to be, or never ought to have been, a spot provision of this resource to a sizable and important number of people. This needs to be an ongoing effort. And seeing examples like this being baked right into, for example, Medicaid, and the example from Oregon gives us some, I think, inspiration about how we can make some of these great actions that were stood up in the shorter run, both with our organization and then with some of our partners, into good ideas that have become permanent, more routine parts of our practice and action. So, yes, really appreciate the question, and definitely have a similar experience and reflections here.
Yeah, thanks, Michael. Daaniya, over to you for additional thoughts on this.
Yeah, thank you. Thank you for the question and for a lot of the great points that my co-presenters have already highlighted. I agree really similarly in terms of recognizing that this was a major concern and issue when it comes to response. I think they've covered that well. Similar to kind of what Michael was saying, I feel like one thing that we're seeing is, while heat is definitely a concern, it may not always be the top priority for folks. So when we talk about long-term planning, it's been really helpful for us to note the co-benefits, which I think people are really connecting with when we talk to our partners. So a lot of when we talk about heat and things like heat pumps or energy efficiency, that part of heat is a really benefit. They're almost like a co-benefit of each other. So we're seeing it pretty well to highlight when it comes to extreme heat benefits to our decarbonization works, like for our heat pump installations. We're also seeing it really when we talk about urban tree canopy, when we highlight the benefits of trees, we're bringing in that heat element. Or when we talk about climate resilience, like that grant that we have, introducing heat as a part of that has been a really helpful approach for us, especially since we know that sometimes government can take some time. So I think being able to integrate heat as a lens into existing programming has been a really beneficial way for us to get things off the ground and also move into that long-term planning piece.
Yeah, thanks for queuing that up. I'll throw out, I'm mindful of time here. I'll throw out one other question that I think was cross-cutting, and I think, Daaniya, you were touching on it, so just invite any other thoughts on it. And then I'll close this out after that question, and we'll have, for those who are interested in staying on after the session after the session, right? The party after the party, the meeting after the meeting, we'll have some breakouts for additional kind of one-on-one, and we'll disable the mute function for those who want to stay on. So my last question here that ties in some things that I was seeing come through is about that. Maybe not so much the co-benefits, particularly that you brought up those examples, Daaniya, but on that same thread, thinking about having to think creatively, thinking about finite resources, even funding mechanisms that may or may not continue to be sustained. You all work in the space or are connected to spaces maybe around climate sensitive hazards and health. And even though we've been, and I know the planning committee has talked about this, starting from the point of extreme heat and learning off of the 2021 heat dome, how are you looking at opportunities and strategies that address multiple hazards or multiple health impacts as you look forward? You all kind of had a few good examples of that threaded throughout the presentations. And just if you had suggestions to colleagues on the line or intentional strategies that you've been using to try to elevate across the board and found those benefits. If you wanted to bring those here in our kind of closing thoughts, that would be great. I'll invite any member of the speaker panel or planning committee to chime in on that if they like.
I can start since I know I already highlighted some examples. I know for us, a really big one has been our Energize program, which installs heat pumps in lower middle income houses or housing, especially in like that heat island area. That's been really helpful for us because the program also works with education and awareness. So I think pairing people with things like utility bill assistance, but also being more cognizant of things like air quality, I think that's been a really helpful approach for us when it comes to multi-benefits. I think, like I mentioned to you with the urban tree canopy work, one of our goals moving forward is how can we get more multilingual communications about heat, but just thinking or about trees, but also thinking of them as like an infrastructure benefit, as well as like indoor air quality, as well as extreme heat. But in general, I think it's been really helpful for us to work with our community partners, since I feel like they help us make a lot of those connections and those tie-ins, especially when it comes to things like community navigators, like Kat mentioned. I think that's been really helpful for us to make that case and also draw those co-benefits. So it's definitely a work in progress, something we want to continue growing into, but those have been some of the strongest examples where I think it's been working well.
I had one quick thing to add to that, which is just, we had this opportunity with the CHAMP project to have almost a year in community listening to what the community wants for policies and co-developing policies. And many of those policies are cross-cutting and can be used. Not everyone in the county is going to be able to go back and work with community members again for 10 months. And so taking that to advocate for some of these other policies, like more green space and multilingual communications, and using that to get funding as we see shifting resources.
Yeah. Oh, Brendon, go ahead.
Yeah. I think I didn't mention this during the presentation at all, but I think working with community health workers, sort of like the navigators in King County, has been a place that we've pivoted, and that allows for a discussion of a lot of different co-benefits, that address a lot of hazards at one time. Along the same lines, I think we're starting to focus a lot on mental health impacts and trauma resilience, and that has benefits across multiple climate hazards and for resilience in general.
Thanks, Brendon. Really appreciate that. See if there's any other thoughts. If not, I will say that speaking of relationships and partnerships, we hope that being here together, everyone's had an opportunity to hear about at least one new strategy or initiative or a potential partner that you might want to follow up with. And to that space, we'll introduce here in a moment some breakouts. I first want to just thank everyone for being here. We're really delighted that you were able to join us for this webinar on lessons learned since the 2021 Pacific Northwest Heat Dome. Hopefully, again, a lot of ideas sparked and relationships here that you'd like to foster and pursue. On behalf of the Center for Disaster Resilient Communities and the Collaborative on Extreme Heat Events, I thank you for being here today. We look forward to staying connected. And we'll go ahead and actually our planning committee and speakers, many have graciously agreed to stay on the line a little bit longer. For those who want to get into a little bit more of a small group discussion, we'll open up some breakouts and keep those open for those who are able to stay on for additional discussion. If not, again, we look forward to staying connected by way of our community of practice. You see the link to our website there where you can sign up to get connected. All right. Thank you all for being here. We'll open those breakouts in just a moment.